A 57-year-old man is brought to the emergency department by ambulance 30 minutes after he had loss of consciousness. His wife says he was making dinner when he fell on the kitchen floor. He has hypertension, and his only medication is lisinopril. He has no history of operative procedures. En route, his temperature was 37.2 degrees Celsius, 99.0 degrees Fahrenheit. Pulse was 90 beats per minute. Respirations were 10 per minute and labored, and blood pressure was 180 over 100 millimeters of mercury. Pulse oximetry on 40% oxygen by face mask showed an oxygen saturation of 99%. On arrival, he is unresponsive. His Glasgow Coma Scale score is 3. He is intubated and mechanically ventilated. Temperature is 37.2 degrees Celsius, 99.0 degrees Fahrenheit. Pulse is 90 beats per minute. Ventilatory rate is 10 breaths per minute. And blood pressure is 180 over 100 millimeters of mercury. Pulse oximetry on an FiO 2 of 0.4 shows an oxygen saturation of 98%. On examination, Dahl's eye oculocephalic maneuver shows absent eye movements, and the corneal reflex is absent. On ice water caloric testing, there is no nystagmus or deviation of the eyes toward the ear being irrigated. CT scan of the head shows a ruptured cerebral aneurysm. When the patient's wife is notified of the patient's condition, she says he wanted to be an organ donor but does not have an advance directive. Which of the following is the most appropriate next step in management? A. Consult with the hospital ethics committee. B. Contact the organ bank for potential donation. C. Determine if there are any patients awaiting organ donation in the hospital. D. Explain that the patient is not a candidate for organ donation because he does not have an advance directive. E. Explain that the patient is not a candidate for organ donation because of his history of hypertension.